Well, hi everyone, this is Dr. Schroeder with this week's video introduction to week number 5 of our course in the Principles of Patient and Staff Education. And once again, a very busy week and a very good week. Um, Most of my time was quite frankly spent grading your papers. This is a very large class. I have 23 of you. And as you've noticed, most of you, all except for a couple of you, the preview window, what's called the Crocodoc file management system in Blackboard isn't working. That's that little thing that allows you to see the preview of the paper and allows me as a faculty to be able to grade, to go in and just make comments into that preview screen without having to download and upload and save and all of that mess. Well, that's not working. And so the only way for me to really be able to grade papers is to download, save, make comments in the paper, and attach the rubric to the paper and then upload it back to you. There's some advantages to that, as you've probably noticed. It allows me to go in and actually make some direct edits in your paper so you can see, sometimes that is helpful. Where it's really difficult to do that within the Blackboard system. But it really is time consuming. It took me a long time to grade those papers this week. Not a complaint at all, just kind of sort of a statement of fact that it was a lot of hours to do that. But everybody should have your paper feedback back. If you have any questions, please let me know. And also, just a quick word on feedback, and this is really true, just kind of sort of an education sense. Realize that feedback is just that, it's feedback. If your grade isn't what you think that it should be, or if you, especially if you read my feedback and you read into it that it sounds like, I'm leaving a lot of negative comments, please realize that's not the goal here. That's not my idea. My idea is just to give you feedback to help you improve. The only way that you can improve is to have pointed out to you those things that maybe are issues, and could be your IPA formatting, and maybe in some of the ways that you're wording or including personal information or personal opinions when they're not really warranted in an APA paper. So the feedback is just to help you with that. And the only way to get better is to get that feedback. So please know that my feedback is not meant in any way as a way to rake anybody over the coals or make anybody feel bad. Far from it. Again, the idea is just to get the feedback to help you improve, help you do better next time and on your future papers. But overall, everybody really did very well. So I just kind of sort of like lay that out there because sometimes as a teacher, you do sometimes feel a little bit under the gun and feel, like sometimes there's so much critical feedback, and it's not meant to be critical at all, it's just constructive. So just know that. Going on to week 5, we're going to, the discussions this week focused on, and your assignment this week that I'll be grading once again this week in week 5 was your PEM assignment, your patient education material. And you've all challenged and struggled with that a little bit, as is the case. It's not quite as simple as it sounds, having to take information that sometimes can be very daunting and very scientific and very technical, and then trying to essentially, we don't usually use this term, but essentially it's dumbing it down so that somebody with a high school education can read it and understand it and know what it's talking about, and using words selection that is appropriate. It's a challenge. It's not as easy as it seems at first. It seems like it should be easier to write something that is targeted at a lower grade level, but actually it's more difficult in many ways. It's like writing a children's book. Not something I've ever done, but I do have friends that write children's books, and they insist that it's actually harder to write children's books because you have to get inside that children's mind and you have to use words that resonate with them. And as an adult, it's not easy to do. It's sort of the same thing here. It's hard to get away from those big words and those long sentences and those scientific jargon that we've all used because we don't understand what it means. Now, how do you explain that to somebody? It's not always that simple. And so the discussions were very rich this week, a lot of activity. And once again, I'll be participating with you as I can as I plug along at grading your papers from this last week. Going on to this week, we're going to be shift focus once again to talk about special populations. Um, Somewhat similar to our discussion last week. Last week we talked about writing education materials for patients that are geared towards a fifth and eighth grade reading level. This week we're going to talk about teaching special populations, and you have one discussion question that's going to focus on how do you deal with a schizophrenic patient. And you're going to have to do some teaching here and sort of think about the ramifications of that. So that's going to be the primary focus of class this week. No written assignments this week other than your discussion questions, so you get a little bit of a reprieve that way. We're officially at the halfway point. We are halfway through class, end of week 4, beginning of week 5. We're on the downhill slide now. So, as always, I look forward to participating with you in the discussion questions. As you have questions, please feel free to let me know. Also, some issues, if you're having any issues with my email, if you've been sending me an email and it doesn't come through, please post a message to let me know that that's the case in the Ask Your Instructor discussion forum. I just want to make sure. I've had a couple students from another class say that they've had some issues getting information through. They just want to make sure. So I just want to make sure with you that you're able to get emails through to me, that they're coming through and that they're not getting bounced back to you. So I look forward to participating in class with you once again. Keep up the great work. Have a happy rest of the Memorial Day weekend, and we'll see you in the discussion forums.